Assalamualaikum, good morning and welcome to the Breakfast at UMHealth Colorectal Cancer Awareness Forum. This forum is a collaboration between the Colorectal Research Interest Group, the Malaysian Society of Colorectal Surgeons, and the Colorectal Cancer Survivor Society of Malaysia, or CORM. Now, the WHO's World Cancer Day 2025 to 2027 theme is United by Unique, which emphasizes the inclusion of all stakeholders' stories in cancer care. So instead of focusing on the surgical aspects of colorectal cancer treatment, this morning we have convened a panel of diverse stakeholders to provide their perspectives on personalized care. Beyond therapeutic goals such as earlier detection and increased survival, we will be exploring patient-centered goals such as quality of life, access to care, the role of lifestyle in cancer prevention, and practical tips on incorporating these into busy modern lives. We will have a Q&A session after the panelists' presentations. So for those online, please key in your questions in the Q&A box and we'll get to them. Now, one of the most difficult things to deal with after receiving a cancer diagnosis is where to get reliable information. Healthcare providers are not necessarily the first nor the most influential source of knowledge. Our first panelist is Mr. Jon Yap Kok Hin, who is an IT specialist in media, but uniquely is also a colorectal cancer survivor. And he will share his perspectives on the internet as a tool. Mr. Jon.
Hi, good morning, everyone. So when I was first diagnosed with cancer in my colon, yes, I had a chat with a doctor, but it was shocking news, yeah? So questions didn't emerge during my consultation with my doctor. So when I went home, more questions came up, and who do I turn to? The internet. It is a double-edged sword. The internet, it's a great tool for information. It contains heaps of information. Unfortunately, it contains good information and bad information. So some information are fake, you can put it that way. We need to be careful what we look for and what we read and consume over the internet. I think people nowadays naturally turn to the internet and get a lot of information. So I think it provides healthcare providers a platform to disseminate the right information. You can reach out, you can tell people, about what to do, things to look out for. And also, for people like me and other survivors, it gives us the opportunity to share our experience. So people who are diagnosed with first-time diagnosed with cancer, they can share with our experience, what we went through and all that. So to discern yourself from the right information, the truth and the fake news, the fake information, I think what is important is the source of the information. Where does the information come from? We need to be very critical with our evaluation. Look at who is providing this source of information. When I wanted to search for information about the medication that I will be taking for chemotherapy, for example, I wanted to know about the side effects. I went to the drug company itself that produces the drug that I was going to take, and I read up the documentation there. So there will be information available, but you need to find the right information. Search engines are very powerful. They will index and display everything. They are, of course, that behind the search engines, that there will always be filters that attempt to filter out what is correct information, what is fake information, but they can only work to a certain extent. Sometimes fake information still gets through, okay? And yeah, so that brings me to the next thing that is the newfangled thing that's available right now, that's artificial intelligence. This phrase has been being thrown about. To me, artificial intelligence right now, we haven't reached in really intelligence yet. The way we know, we understand intelligence. To me, artificial intelligence, the chatbots out there, the chat GPTs out there, they are basically search engines on steroids. They help you collate information, grab information from all over the internet and just put it in front of you and present it, make it presentable in front of you. Again, all these chatbots, they rely on your question, how you phrase your question. Phrase your question properly and you will get the right information. If you phrase your prompts too generally, you may likely get misinformed. Sometimes some search bots, some AI bots have been known to fabricate information. If you don't craft your prompt properly, they call it AI hallucinations. So there is pros and there's cons. Yeah, there's danger in getting fake information. So just wanted to warn everyone. Yeah. Okay.
Right, that's very interesting that even AI can have diseases like hallucinations. So it's very interesting to hear your perspective because you are not just a survivor, but you also have, your expertise within the media space. And to me, a lot of this reliance on other sources of information is perhaps because there's been some loss of trust in the healthcare providers. I mean, my grandparents' generation, you wouldn't even question what the doctor says, right? Whereas now it's like, it's strange if you don't question what the doctor says. So how can healthcare providers regain that trust from patients so that at least they are willing to discuss what they have read in other sources? So we're not saying don't read, but at least discuss it with your healthcare provider.
Yeah, I think as healthcare providers, I think you have to acknowledge the fact that there is information out there on the internet. Be as transparent as possible. Be open. Don't be defensive. Your patient or your client comes up to you and asks you a question, address it. And I think what is most important is empathy. You need to understand why this person has gone to the internet to look for information, and it's wonderful if he or she comes to you and tries to verify this information for you with you. There is a certain amount of trust already. So be empathetic. So empathy is different from compassion. I just want to make that distinction. We're not looking for pity. We want you to understand and be in our shoes for a little while to understand what we are going through. Why do we search for information on the internet and not come to you? Well, because maybe privacy. We have certain things that are very personal. We may be embarrassed to ask about it. So yeah, be empathetic. I think that's most important, and you will build trust that way.
I think that's absolutely true. As a patient, all you want is that your voice is heard and that your views are taken into consideration and that it's a shared decision making at the end of the day, as long as you're aware of what the pros and cons of what is being done are. All right, so I'm sure we'll come back to you in the Q&A session, but we'll move on now to our next speaker. We were talking about, where do you look for information when you receive a cancer diagnosis? But once you have received it, the other side of it, and Jon alluded to it, is that everything changes. The whole world changes when you receive a cancer diagnosis. Navigating that change is incredibly difficult, even if you are well informed. And our next panelist, Mrs. Tengku Nazeehah Tengku Mahmood, or Zizi as we call her, she is a multi-hyphenate. Okay? She's a colorectal cancer survivor, she's an ostomate, but she is also a certified patient navigator, and she's going to share her perspectives on navigating change.
Morning, everyone. So this morning I'll speak about living with a stoma. So some colorectal patients will end up with a stoma. Of course, having a stoma will be life-changing for an individual. Not only are they forced to come to terms with the loss of control over the elimination of feces and urine, they may also experience many other consequences physically, mentally, and emotionally. Well, definitely it's a big change. So physical changes, especially your body image concerns, adjusting to the presence of having a stoma in the abdomen. The dietary adjustments also needs to be changed to ensure that there's no blockage, or how to manage the stool. And also the stoma care routine is a big deal, is a big thing. And not surprisingly, not many patients take to it easily. Also, there's always the thought of having potential leakage and accidents in public, or which changes the social perspective of your life. There's also privacy concerns in the social changes, where it's not easy to manage stoma discreetly sometimes. So then it comes to some individuals withdrawing themselves socially, not wanting to be in groups or outside with people. So there is a need of communication between your support system, your family and friends. Therefore, helping you manage life more easily. Then it comes to the emotional impacts, where there's anxiety and stress for the fear of the social stigma, leakage. There's depression, whereby you withdraw yourself and you feel like you have low self-esteem, and even impact on intimacy, the concerns of the body image and the stoma, and having a stoma itself. So how to embrace change? This I put together myself. Shifting perspective, as in, say you were a marathon runner all the while and you've run a full marathon. So after surgery with a stoma, it's not that you can't do it, but you probably want to start with a 5 km run first. It's okay. It's okay. I think you're able to do anything with a stoma, and it should not stop you. And also confronting uncertainties. If there are uncertainties, question it. Go to someone, go to a professional, go to the doctors. Hence why peer support is very important. I found quorum in my journey, and I believe that helped me not go through depression and having low self-esteem, because I met a bunch of people who went through what I did every step of the way. There is somehow someone who has gone through what I have gone through. So it is very important to consider support groups, healthcare professional guidance, and having a very open communication with your partner, your family, and friends. I think I will stop there for now.
Yeah, so thank you very much, Zizi. It's really important for us to understand as doctors and healthcare providers, it's not just about the physical. I think we tend to focus very much on the physical, let's get the tumor out, let's make sure you recover from the surgery physically. And it's often not prioritized regarding the mental recovery. Correct, yeah. So thank you for highlighting that. You mentioned that social support is important when you're facing such disruptive changes. But oftentimes the family members themselves, what they want to be supportive, but they don't know how best to be supportive. Do you talk about it? Do you not talk about it? That kind of thing. So from your perspective, how does one even start to offer support, and what kind of support would be most appreciated?
Well, parents and family have their own ways. At times, friends too, they mean well, but they'll come up with, oh, why not you try this and then, and you'll be overwhelmed with all these things. Sometimes just to lend an ear, just to be there, and it's back to empathy again. It's back to empathy again. Just helping out with little things like um, having the kids for a while, for a few hours, or doing some of taking over some of the daily chores or things like that. Just to be supportive. Sometimes it's not about lending an ear, just to be heard. Just that how the patient's feeling, what they're going through, and not add on to it if possible. Yeah, mostly that. But it really depends. But having peer support is still another side of that balances out things.
So I also heard you mention something about those that maybe isolate themselves from others. And so in that situation, let's say if you are the patient and you are socially isolated, how do you reach out? What are the avenues for you to get perhaps that emotional support?
Um, well, as a patient, there are good days and bad days. There are bad days where you just feel like just being alone and not wanting to connect with anyone. But I believe if you belong, like there's always the NCSM helpline if you want privacy and not be face to face with someone. Other avenues like Quorum has a WhatsApp group. You can be silent in the group but still read through what other people are going. I mean, find find a common ground. Find people who there's always people who have gone through what you've gone through or even worse. You have to help yourself first. You have to start crawling first before running. So that's very important for the patient itself to want to do something and help yourself. Then others can help.
So you mentioned the NCSM helpline. So for our audience, just tell us a little bit what NCSM is and what is the helpline.
NCSM is the National Cancer Society of Malaysia. Um, some of us, some of the colorectal cancer patients and some members from Quorum have gone through a peer navigation group whereby we visit some hospitals. There are some hospitals that we go do our rounds and we're available for peer support. And also there's a helpline if you don't want to meet, whereby you can call this toll-free number and you're able to speak to someone. You're able to speak to someone and they can help with many things, with your burden of barriers, with any issues you have at all. If it's possible for us to help, we will help.
That's wonderful to hear that, anyone has access to this helpline, and I hope that if you know somebody who maybe would benefit from this, just let them know that it's available. So thank you very much, Zizi. Now I'm going to move on to the topic of food. Malaysians love their food, right? And our next panelist is a registered clinical dietitian. She has expertise in medical nutrition therapy. Not only is Ms. Rozanna M. Roslani experienced in managing hospital and outpatient food services, she has recently embarked on a master's in public health, lifelong learner, to pursue her research interests. She will tell us about the role of diet in the various phases of the colorectal cancer journey. Ms. Rozanna.
Yeah, hello, good morning. Assalamualaikum, Assalam Ramadan. I became a dietitian because my grandmother was diagnosed with colorectal herself. Yeah, so it's important to read. It's important to read reliable source. It's important also to listen to people. Sometimes the old school might do better because if we advise somebody who's old school with the newbie, they might not be able to take in your advice. So sadly, when they come to see a dietitian or refer to the dietitian, we are not the first one they listen to. It's normally the one at the market, the neighbor, what auntie had it before, they read somewhere. I mean, I wish I could read Chinese newspaper, you know. and all sorts now with internet, TikTok, God knows what else is there out there. So it's important to also, like I tell my mother, do not believe everything you read. Yeah, sometimes they can be gurus, they can be having a 1 week course and suddenly become an expert in nutrition. It took me a long time. Number one is to listen to the patient. So when they come diagnosed already, sometimes they already have oh, what have I done wrong? Everything I've done is wrong. It caused me to have the cancer. So I'm not going to eat, I'm going to fast, I'm going to only drink water, I cannot take milk, I cannot take meat, I cannot take, so by the time they come to see me, it's not rehabilitation, they are starving. So it's important to nourish your body. It's important to have the balance. I always believe it's important to have the balance in life. Means a balanced diet, because if you're going for surgery, it's a big deal. It's a very big deal. If you lose a lot of weight, even though you're obese, you lose a lot of weight, you lose muscles, you lose energy, your recovery is going to be longer, you have risk of infection. So we have to check for nutritional status. If you're unfit, you cannot go for surgery. So it's important to have the muscle strength, and balanced diet comes with everything, from vegetables, fruits, your proteins, your carbohydrates is very important. So we look at that as like the plate. So when you look at what was before, they eat before they become really full. So now you eat like a fool because you eat really, really, oh, this is a buffet, I'm going to eat my money's worth. So that is why we have a lot of disease now. You eat, you don't eat, you no longer think when you eat, you just eat, so it's important. And you tend to become dehydrated, yeah? So I always say, okay, or overhydrated. Sometimes you drink a lot that you become too full. Most of the time they feel full very easily. I kenyang, I feel full. So that's what, before surgery. So I say in between, take sips, of oral nutritional supplements, because some patients we assess and they're unfit, they lost muscles, they don't drinking, they take too much, so you have all these nutritional drinks. Sometimes minum air, oh, I can't taste, I have tasteless, so I say infuse it with things that you like, yeah? And it's important, protein. So it's very important to have protein foods. When we say priority eating, so eat your proteins before you get full. If you eat your sayur, your vegetables, you get full very fast. I'm not saying you just eat your protein to become a keto person, no. But it has iron. You need to up your iron levels, your hemoglobin levels, and there are times where the surgeons or myself advise a lower fiber diet. It doesn't mean that you don't take fruits and vegetables at all. So it's because we don't want further blockage, yeah? So we have a lower residue, so things like whole grains. I know these are good, they are cancer prevention, but before surgery, we do have some pantang larang, yeah, that we need to go with. Next. And see, after the surgery, there are a lot of, it depends on what type of surgery you went through. So normally we go with nutrition. Nowadays they don't fast for very long. So we do give clear fluids first. It can be for half a day, it can be, doing very well, clear fluids tolerated. Then when they're awake, clear fluids. So I give clear fluids and nourishing fluids, because once you can drink water, then you can go on to something that is more nutritious, soups and things like that, and softer consistency, softer texture. I have had to argue with a lot of things. No, I like my rice. I say yes, but we need to have softer, because the surgery takes in a lot of changes, yeah? And not one size fits all. I always advise my patient, eat slowly, chew your food properly. Yeah, it's very important for digestion. And if you have smaller meals, it's better tolerated, it's better digested. Yeah, and you have lesser stomach output. So if you have a gap in between your meals also, you have higher stomach output. Yeah, and it's very important to drink. And if it's an ileostomy, you tend not to absorb the salt, the potassium, and the water. So you need to have more water in between. Fruits that are higher in water content. Banana, for example, is high in potassium, So it's important, and when we follow a lower residue, this is temporary. Sometimes it can be 4 to 6 weeks, it can be longer, it can be shorter, yeah, but do not be afraid to try. And not every food the person next to you has, output is going to happen to you. So I would say, okay, you eat one thing and you sort of note down, but try it again. It's like when you're falling, you want to come up again. Not all foods, and then when we look at that, those foods thicken the output, like things like starch-based, they thicken the output. Marshmallows thicken the output. Yes, sugar and all these things, but you need to be comfortable. Yeah, when you have too much stoma output, you have to change the stoma bag. It makes you feel like I should not eat anything and things like that, and you feel gassy. So fried food, carbonated drinks, they're gassy. I always say don't drink with too much, using the straw. Yeah, so using the straw nowadays, they have all this like cups with straws that are all causing gas. Next. So, so the rehabilitation and the chemo, not sometimes they are chemo before, sometimes they are chemo after, and not everybody has the same effects for chemo. Very important is to eat well. Sometimes you need softer food. Not everybody likes porridge, some people do not like, saya tak makan bubur, so softer rice. Sometimes cold food, they're like, oh, cold makes me cough, and I say cold food's easier to tolerate, yeah? And smaller meals. Adding calories is important because you need, not only you need protein, you need calories, you need all the vitamins and minerals for wounds to heal. And I always look at following the World Cancer Research and the American Institute of Cancer Research guidelines. Go online, they have the colorectal part, they have the breast cancer, they've done a lot of research. They followed up, it's from 2007, so they did the first paper in 2017. They saw how the reduced in cancer recurrence when you follow these guidelines. These are things that is evidence-based, yeah? And I put the myth on the right side because I get asked a lot about cooking oil, cooking oil guidelines are not more than 3 times. Please, if the cooking oil change color, you have to chuck the cooking oil. And I always hear about alkaline diet, it has to be acidic and alkaline. I'm like, oh, very interesting. We all have hydrochloric acid. Our body functions well. You don't need any alkaline base, acidic base, yeah? And the last one is organic, organic diet. It's not that organic is good or bad, it's expensive. Vegetables and fruits now is expensive. I say we are blessed to eat, so when we can eat, it's, for me, just wash your fruits and vegetables, yeah? And now when you have after surgery, please peel. Normally we say, oh, skin is good, yeah? But please peel it, peel the skin because they are like, not easy to digest. I had to chew a lot of the apple skin. So I was telling a story, I had a patient who thought fruits was good, eat apple a day. He ate 9 apples. He had an obstructed, after the surgery, was an intestinal obstruction. So I said, what made you take I read somewhere. So apples, I say, apples are good, but 9 apples is not good. So moderation is very important. Variety is very important, and there's no harm. And for you to have your ikan masin, or your ikan bilis, or your udang kering, or your belacan, if it makes you happy. Because happiness reduces recurrence. We all grew up with the nice food. Doesn't mean that you have cancer or any disease. You can't have everything. So it's important to enjoy. Yeah.
And that ties in very nicely with what Zizi said earlier, about it not just in physical health, it's also mental health, emotional health, right? And if you're eating something that you enjoy, that gives you a lot of emotional benefits. So I like that you mentioned, a lot of the things which is research backed, and also the fact that we often struggle with getting patients to believe what we say as opposed to my uncles, aunties,
Yes, correct.
third cousin kind of thing. But in your experience, when dealing with cancer survivors, what do you think is the most difficult dietary change that the most difficult thing to convince them to make in the diet?
I think the most difficult is because they self-blame also, what I've done wrong. So what could I do well or right? I always tell my patient there's nothing wrong to make right. We have to move forward and do the best. If you like to eat this food during your surgery or before, then go for it. But do not eat too much of it, because one food did not cause your cancer. Or removing this food will not sort of cure it either. Yeah, but I always do. I'm very open with my patients. You have to listen. You have to have empathy, but you also have to be like, I like my nasi lemak. What if I tell a patient, oh, you can't have your nasi lemak? It's like telling me I don't eat my nasi lemak. I'll be so depressed. It's very important to make the change is difficult. Like tell the patient to stop smoking, to tell the patient to lose some weight, to tell, but we have to, as a dietitian, I can't just say this is good for you. Maybe we can reduce it to once a week or something, because all these things are proven, especially the preserved things. Because I always do a very, very thorough diet history with my patients, so I know what they have done before, what they need to change with, and what can the before food can we incorporate in their diet. Because if you go out with somebody from Kelantan, Terengganu, for example, they like certain things like budu and things, and then here you are eating a soup base while your family is eating the budu, the whole belacan and everything. It's like you're on the diet, but the rest is eating that food. So, I mean, it has to be the whole family. I always say, it's a family chain. What makes you think that you cannot have it? I say, yeah, your father had it, but what makes you think you cannot have it one day? So the whole family, like peer support, is very important. Like even a child is obese, you can't just say, oh, the whole family can karam the kappa and the child is on a special diet. I said, cannot be. Your whole family has got to incorporate, because it starts from the whole family. She could be cooking for the husband or the child, but or she could be neglecting her nutrition. And the whole family has got to put in the 10%, the 5%. I will call the family. If I do not see family, and see the family alone, I will normally call the family. I say, what is wrong with this patient? Where is the family? I cannot counsel the patient after the surgery because you're not listening. So that the right time, Prof, is very important. If they're not ready for advice, we cannot go in there and do any change.
And this is where, when we were talking about social support, actually being there when the consultation is happening, that can sometimes be helpful, because oftentimes, and this is my experience with patients, the patient themselves is kind of shell-shocked. They've just received the diagnosis, and so they might not be taking in your advice at that point in time, but the family members, they can often help by reminding them, this was what was discussed. So it's really important that the family also makes a change in their diet to help support the cancer survivor. So now, one of the other things we say is, if you love your food, then at least, you need to exercise to work off the calories, right? Malaysians love food, and we also love watching sports, but we are not necessarily the most physically active population. So we're going to invite our next panelist, Professor Muhammad Nahar Azmi Mohamed, who is a professor of sports medicine at the Faculty of Medicine, University of Malaya, to discuss the importance of exercise in colorectal cancer care. Prof. Nahar.
Thank you very much, Prof. April. Assalamualaikum warahmatullahi wabarakatuh. Very good morning to everybody. Ramadan. Okay. Physical activity, exercise, and nutrition or diet is actually work along very well we need to work together in terms of looking after our patients, especially before they going for any form of surgery, and especially when they first start. We receive referral, especially from this point, colorectal or cancer patient, colorectal patient. You know that going for a surgery as if you are going for a marathon. So both surgery and marathon, you need to prepare yourself. At the point when patient being referred to us, most of the time their physical activity level are very low, or most of them are very sedentary, not even doing any sort of physical activity exercise, or not even move. And recently I received a patient, a female patient, 49 years old, colorectal cancers. She just said that, oh, have you been exercising? Well, no, never, none. All the time I'll be at work and on my desk and I do my work, going out in the morning and come back in the evening, and that's it. No, nothing at all. So just imagine when you come, you have to assess. We need to assess them before we start whether or not this patient should fall. Let's say we need to do proper objective measures. But of course, in the end of the day, before going for operation, these patients need to be prepared, and with the type of activity or how we're going to prescribe a program for them before they're going for operations. You know, maybe at the time we receive the referral, patients are very ill. Some of them are very ill, and even age more than 80 years old. So how do you expect we're going to, improve the fitness level between for the next 2 weeks, which is very impossible. You need to at least have a nice suitable time, 4 to 6 weeks at least. Yeah, some individual, they are very individual, and then you cannot plan a program suit for everybody. So you have to assess them. We have to assess them and make a proper program. And some is very challenging to improve or increase their intensity because of their conditions. At the time when they referred, they are, very headsick or sarcopenic, very lethargic due to the conditions, hemoglobin very low, and they don't have any appetite. So how to start them with this so-called activity? So of course, at the very beginning, diet is very important. Need to incorporate with this because they need energy to perform, and they need to improve their hemoglobin before they can perform their activity. So, but still, we need to start something. Okay, they come, if they are, before this, they are a marathon runner, like Zizi mentioned, they don't have any issue. We just straight away assess them, okay, they're fit for the operation. For example, just they need to continue their activities. But if they're in between, that's another thing. You need to make a plan and proper plan for them. Okay, so individuals that come to us, they are at different level. So, why this is important to improve their fitness level doesn't mean that they need to become fit, like they can run. No, it's not possible. Yeah? But as long as there's an improvement, they will give a bit of hope of reducing the risk. So the intention is try to reduce all the risk factors that might occur during the operation or after the operations. And at the same time, we would like to cut down their stay in the hospital, recovery faster. So that's another thing that we would like to encourage when patients, before going for operation, we need to improve their so-called fitness level from their baseline. Okay, but the challenges is, if let's say most of the time patients, colorectal, especially majority, I'm not saying everyone, so majority of them 60 above. Yeah, and then when they come, they are very skinny. When we measure with our body composition weighing scale, yeah, or body impedance analysis, their muscle mass are very low. Even recently, we received one. So it's under. So of course, they still good things. She can move around. She's still active at home doing the chores. That's good. At least when perform the test, fit for the operation. But then the thing is, the muscle mass low, need to improve on that also, because it may contribute towards the recovery later on. Yeah. So these are the challenges that we are always facing for patients, elderly and with sarcopenia. But then come, so how are we going to start to prescribe or plan a program? Like I mentioned earlier, 88 years old, more than 80 years old, very ill, bedridden all the time. Even when I try to encourage patients to stand, it's really unstable. It can't last even 5 minutes. So very, very challenging. So we start somewhere, encourage movement. So even nowadays, people when we talk about exercise, people said, "Oh, I have quite a number of patients. Oh, don't mention that dirty words to me. Exercise is something dirty to me." And some of them said, "Oh, I don't have any time going out in the morning and come back in the evening. So, but I do some house chores, which is actually good. So just make that increase your physical activity." Like house chores, or because nowadays we are depending so much on technology, which is actually good in a way but bad in another way. So we need to increase our activity or movement at least. So for this patient, when we start, we have to increase their movement. So just movement on the bed, or just start sitting at the bedside, or change from sitting to or the bedside to chair. So just increase the movement. So just make it more frequent. So of course, when they are a bit frail, need somebody to assist. So family support is very important in terms of trying to make them move. So if they depend so much on patient themselves at this stage, it's very, very challenging. Even they don't do, even when they already in what we call that in ward, they come to us and supervise. But when they go back, do you think they can do with that kind of fitness level? Of course they can't. So family members is very important to assist on this. So when possible, when patients come to us, family members, it's possible to come also and at least know what we want. Most of the time, family members very supportive, but at the point there are patients where no family members around. That is very challenging for us to make. Of course, I've shown quite what we call that a template of program, but it won't suit everybody. So we need to properly plan accordingly to the level of patients when they come. Same thing after operation, or when they gone through the operation, they've done their what we call, and they have stoma, like Zizi mentioned. Doesn't mean that they can't. I have quite a number of colorectal patients with stoma. They still can swim. Jessie, Zizi herself a diver. So you just need somewhere to protect the stoma from being spilled out. That's all. So, and then of course that is something you need to get somebody to. I mean, is a group support is very important. So join the group support which have similar conditions, that may have more experience in terms of how you to get back to become more active after the operation or after this illness.
Well, that's great. I mean, I think for many people who have led sedentary lives, it's almost like changing your diet, right? You think like it has to be a massive change all at once, and actually it's not. You can just do little things that will help. Now, in the interest of time, I'm just going to move on to the next two speakers, the two panelists, and if we have time at the end, we'll take questions. So we've heard some recurring themes here, listen to your patients, get family support. And of course, healthcare providers do want what is best for their patients, but when you're in a busy clinic, it can be difficult to address every patient concern in that 5-10 minute encounter. In addition, we talk about access to care, including adequate funding, and that requires advocacy work that is not necessarily only done by healthcare providers. So our next panelist, Ms. Wong Heong, actually began her career as a nurse, and through her work with ostomates, she transitioned into social advocacy, particularly with Quorum. So she's going to discuss the role of patient advocacy and navigation. Ms. Wong.
Thank you, Prof. Good morning to all of you. Actually, for patients, they need support from the social group. It is to help them to get through their journey easier. Colorectal Quorum is, the full name is Colorectal Cancer Survivorship Society Malaysia. As the name indicated, it is an official voice in Malaysia for colorectal cancer patients and survivors. Quorum was established in 2013 by a group of colorectal cancer survivors, medical and allied health professionals, including some of the volunteers who are non-medical professionals. Quorum's mission is to improve the quality of life of the affected people by colorectal cancer. We offer support, advice, and also to organize some activities which is therapeutic for them. And also at the same time, we will provide along the way to provide some advice in their rehabilitation. Last but not least, of course, one of the mission is to educate the public on the prevention and early detection, because this is important to reduce the cases of late diagnosis, especially in our country. Next slide, please. Okay. In Quorum, we have started training the peer support volunteers in 2014. So you may have heard about some of the activities that we do in different hospitals, and you might be wondering what is a peer support volunteer role and also what they are doing. Okay, there's also another term that you can see from here, patient navigator. So I will explain some of the differences in these two. Peer volunteers are people who provide information, advice, and support to others in their community with whom they share similar life experiences. Mostly these are the colorectal cancer patient or cancer patient in other organizations, or it can be also the group of people who have gone through similar condition. Yeah, I would like to stress here, actually, even though the two patients, even they have got same diagnosis, they may have gone through the same surgery, but their life experience is never the same. Yeah, we can only say it is similar because everyone is unique. Okay, for peer support volunteers, most of the time they're actually from the self-support group run by trained volunteers. They are supporting the peers, and also the focus is more on emotional care. And as you know, patients who have been diagnosed or they have to go through treatments like chemotherapy, radiotherapy, they go through a lot of emotional turmoil, and also a lot of physical changes to them. So our peer support volunteers are there to help them reduce the feelings of isolation, because they know they are not the only one. So there are many other people out there with a similar problem, and also they can still lead a very normal or near normal life. So in this also it helps to increase their feeling of self-worth and also their self-sufficiency. So with that, the main objective is to help these people to build trust and confidence in themselves. Okay, now we look at the patient navigator. What are the role for them? Patient navigator is actually a program, very structured program that it is actually conducted for professionals. Can be the volunteers can be the patient navigator can be professionals, layperson, or peer. Not necessarily all of them are patients, unlike peer support volunteer. The term peer explain that they are similar condition. So patient navigation is actually a support system that is in the healthcare delivery, and it is a very structured program that focuses on patient-centric intervention. And this intervention, or what they do, aim at eliminating the barrier to timely diagnosis and treatment of cancer or other chronic diseases. So in this is some condition that I just explain a bit further about what we do. Yeah, of course, the professional patient navigator, they are usually the paid staff or salaried staff, whereas the lay person or the peer who are trained, they can be volunteers. Yeah. So for patient navigator, usually what they do is we have to identify possible barriers when we refer the cases to the possible barriers can be actually like financial, communication, and also information, as well as the medical system, because it can be quite confusing or can be quite daunting to the new patient. Yeah. A lot of times these patients are actually having a big barrier that is actually not so much of what I mentioned earlier. It could be actually the barrier of their emotional, their fear, their distrust. So I think earlier you have also hear about the sharing from others. Yeah. So this barrier can be actually the barrier that stop them from getting treatment. So they become one of the defaulters, and sometimes they tell us that they they are not getting what they want, and they wanted to actually go on their own treatment. Of course, that is also their own their own choice lah. But we informed decision whereby they know what are the pros and cons. Yeah. Patient navigator. Okay. Patient navigator will be also helping to support the timely movement of the things for them to get their treatment and all that, and also doing some profiling to help patients to uncover the unmet needs, and also to provide them appropriate resources to decrease the difficulty in their journey. Okay, the main objective is to improve the access and also promote the integration of care.
Yeah, so that's very interesting. Patient navigation, intuitively, it looks good, right, in theory. But it's actually quite difficult to do in reality. And so perhaps later we have some time, we'll go into some of the challenges that you have faced. So as I mentioned, advocacy at the national level is certainly very important for initiating systemic change, but for the individual patient, local support is crucial. Our final panelist is Ms. Angie Ng May Lin, who is herself a colorectal cancer survivor. She will tell us how she has used her own colorectal cancer journey to help others as a quorum peer support volunteer. So Ms. Angie.
Hi, good morning, everybody. I started as a peer support volunteer about 8 years ago after my recovery from my surgery. I was thinking on the hospital bed how I can help the patients in the clinic better. So here I am today. I felt that because we, as a support group, we can provide a face-to-face meeting for the patients, the caregivers, the survivors, and we just share our experiences and our coping strategy. The most common thing the patient or survivor asks is diet. A lot will say, I can't take sugar. Why? Because sugar feeds cancer cells. So I have to explain to them, no, it's not true. Or they will say they can't eat fish with the scales. So I ask them, how are you going to get your nutrients to fight this battle? They can't. So I say, there, please eat. And then another thing is some might have fear about their prognosis. They wonder how long they might live, or how it can affect their work or their family members. So we just have a chit chat with them. We do have a room in PPM. If they want a private chat, you can up And, or they, when they're in shock, when they come out of the doctor's room, I look at them, they feel like a bit disorientated. I just go forward and help them. Mm, okay, we can talk about here as well. Apart from having the peer support group in the clinic, we do go outside to the community to help raise awareness. Yeah, and in this picture, you can see the peers, volunteer, and the navigators. We're going to attend to the CRC patient, and then some of the volunteers. When I meet new members, I will introduce those other in the group in person to our fellow members, so we can share our experiences. Yeah, and then I was just having a chat with an uncle, newly diagnosed, so they were waiting to be told what stage he is. So I just met them again last week, and they were like stage 4, but I said any problems, they just kept quiet at the moment. Another on the bottom. Okay, in this picture, on the left is a colorectal awareness event in TTN with all my volunteers. And then on the right is community awareness. Again, in the Bold and Beautiful Fun Run, they invited Quorum to have a booth there. So I was helping Wong to raise awareness there. And then on the bottom is colorectal survivor. We have this picture taken after ESG under our Professor Nahar. I would say with this support group, it has helped me to meet a lot more survivors, and it motivates me to go on and do it better. And being able to help fellow members is very fulfilling as well. And at the same time, it helped me to extend my network with other survivors, so that it's handy to help other survivors too. Yeah.
Right, thank you. Thank you very much. I think there's a number of recurring themes that we have heard this morning from the different panelists. So for the healthcare providers, listen to your patient, individualize your care and make sure that that care is holistic in nature, show some empathy. I think from the survivor's perspective, it's how they value the support of their family and friends, as well as peer support groups, advocacy groups. And from our experts here, the diet is important. So make sure you've got the right diet in place for your recovery. And, physical activity is not just running a marathon, but anything that you do every day, just move. Just move. Whether it's upper body, lower body, whatever, just move, and that will be good for your health. We're going to just check whether there were any questions on the chat. All right, it's telling us we've reached our recording limit, so I believe we have to end here. I hope that this morning's session has provided you with some different perspectives, especially for the healthcare providers listening in. Your patients are people too, they are not just a disease or something to be treated. So see them as a person and try to individualize your care so that they can get the best possible outcomes. And for the patients or the peer supporters of patients, yes, there's a lot of information out there, but be careful about what you believe in. And in general, healthcare providers are here to help you through your journey, and we only want what's best for you. So have that conversation with your healthcare provider, and I'm sure with that, we can together make your journey much more pleasant and palatable. So with that, remember March is Colorectal Cancer Awareness Month. That's why we're all wearing blue. And I hope you will take this opportunity during the month of Ramadan to learn more about colorectal cancer. and take the necessary steps to prevent yourself from getting it or to support others who are living with it at the present moment. So thank you very much for your attention. Assalamualaikum warahmatullahi wabarakatuh.